The year 2019 drew to a close with a sense of normalcy. Unbeknownst to the world, a storm was brewing. In the bustling city of Wuhan, China, a mysterious illness began to spread. Dr. Maria whispers of a new virus traveled through the medical community. Confusion reigned as doctors struggled to identify the cause of this unusual pneumonia. The world watched with bated breath as news reports started trickling in about a novel coronavirus. Theories about the virus's origin abounded. Dr. Maria, some pointed to a live animal market in Wuhan, suggesting zoonotic transmission. Others proposed a possible lab leak. The scientific community raced to find answers, desperately seeking patient zero to understand the virus's transmission. Fear and uncertainty gripped the globe as the virus, later named COVID-19, rapidly spread across borders, turning into a full-blown pandemic. Dr. Maria, the World Health Organization, issued warnings, urging nations to prepare. Countries scrambled to implement measures to contain the virus, but its invisible nature made it a formidable adversary. Borders closed, travel restrictions were imposed, and lockdowns became the new norm. The world was put on hold, grappling with the gravity of the situation. Scientists around the world worked tirelessly, united in their mission to understand the virus. Researchers diligently studied its structure, mapping its genetic code and identifying its mutations. Professor Kim, every new piece of information was crucial, providing insights into the virus's behavior and potential weaknesses. The global scientific community collaborated on an unprecedented scale, sharing data and research findings in real time. Amidst the scientific scramble, healthcare workers became frontline heroes. Doctors, nurses, and medical staff faced the virus head-on, battling exhaustion and fear to save lives. Hospitals overflowed with patients struggling to breathe, hooked up to ventilators. Personal protective equipment became a lifeline, but shortages were rampant, putting healthcare professionals at risk. Nurse Huan down. The pandemic unveiled the resilience of the human spirit. Ordinary citizens stepped up, volunteering their time and resources to support their communities. Teachers adapted to online learning, keeping education alive. Essential workers ensured the continuity of vital services, often putting their own health at risk. Acts of kindness and compassion blossomed, offering glimmers of hope in a time of darkness. The pandemic's impact was felt unevenly across the globe, laying bare existing social and economic disparities. Developing countries with fragile healthcare systems faced immense challenges. Mr. Singh, access to testing, treatment and vaccines became a matter of privilege, highlighting the urgent need for global health equity. Marginalized communities were disproportionately affected, facing higher infection rates and mortality. National responses to the pandemic varied greatly, revealing different approaches to public health crises. Some countries implemented strict lockdowns and widespread testing, while others adopted a more relaxed approach. Dr. Oliveira, the effectiveness of these measures was debated, with no one-size-fits-all solution. The pandemic tested the limits of healthcare systems, economies, and social fabrics worldwide. Despite the challenges, the global scientific community achieved a remarkable feat: the development of safe and effective vaccines in record time. Dr. Oliveira. Collaborations between researchers, pharmaceutical companies, and governments accelerated the vaccine development process. The first vaccines emerged as beacons of hope, offering a way out of the pandemic's grip. The COVID-19 pandemic left an indelible mark on the world, forcing us to confront our vulnerabilities and re-evaluate our priorities. The pandemic served as a stark reminder of the interconnectedness of global health. Dr. Maria, it highlighted the crucial role of international cooperation, robust healthcare systems, and proactive public health measures in responding to global health threats. The long-term consequences of the pandemic are still unfolding. The economic fallout, the mental health toll, and the disruption to education will continue to be felt for years to come. Nurse Huan, however, amidst the challenges, the pandemic also fostered resilience, innovation, and a renewed appreciation for human connection. As we move forward, it's crucial to learn from the lessons of the pandemic. Professor Kim, strengthening healthcare systems, investing in scientific research, and promoting global health equity are paramount. Mr. Singh, we must remain vigilant, prepared to confront future health challenges with the same spirit of collaboration and determination that characterized the response to COVID-19.